I'm Derek Hildebrandt. Welcome to a special edition of the Pipeline on the Western Standard. It's 7 p.m. Mountain Standard Time, coming to you from Calgary, Alberta. I'm joined today by both a special guest and a special guest host. We're going to be joined by David Redman, former Lieutenant Colonel in the Canadian Armed Forces and the former head of Alberta's Emergency Management. This is a special guest that I felt inadequately qualified to host. So we're joined today by our special guest host, newly free agent Danielle Smith. Welcome. Thank you both for joining.
Well, thank you
very much
so
for
much.
having me.
Do you want me to just take it away then from here, Derek?
Just a couple quick, actually, I promised I'd be quick, but now that I got you in here, I'm going to take actually just a minute real quickly. Just a couple of housekeeping measures. Everyone who's already a Western Standard member, thank you very much for your support. We are proud to have it. If you're not yet a member of the Western Standard, please go to westernstandardonline.com/membership. You can become a member for as little as $5 a month, supporting independent Western journalism that refuses to take a bailout from the government. That's it for us. But before we go, we have a special mention of our sponsor, Kyron's. I always have a hard time pronouncing this one. This one kills me. Kyron's Way is today's sponsor. Are you suffering from stress or anxiety right now? I am. Right now, check out their natural and affordable plans during these natural and unaffordable times. Check out kironsway.com for more information and to support a great local Alberta business. So with it, I'm going to stop embarrassing myself here. I'm going to hand the microphone over to Danielle, who is our special guest host we're very happy to have today. And she'll take it away with David Redman for her special program. Take it away, Danielle.
Thanks. I'm going to need some of that stress buster, Derek. I asked my husband if he'd take the dogs out of the room, and he hasn't yet. So they might photobomb me with a bark or two.
Rookie move. You gotta lock them up.
This is my first time actually doing something independent like this, and I'm delighted to, because I love independent journalism. I've found, especially in the last couple of years, that some of the most interesting conversations are taking place in this medium, and I'm so grateful to you for asking me to be a part of it. For those of you who don't know me, I used to be a radio host on Chorus Radio. I ended my time there on Friday with the song saying, "We'll meet again." And I bet many of you didn't think we'd meet again this soon. But I've met David Redman now a couple of times. I'm delighted to be able to meet with him again for a third time, because I always felt like our conversations were cut just a little bit short. And he's been really waging a one-man campaign to try to get politicians to take a different type of approach, more along the lines of the Great Barrington Declaration of focused protection for our most vulnerable, not because he thinks that there's a trade-off, but because he thinks that's the best way to protect the most vulnerable and make sure that we've got the right balance. He has extensive experience in emergency management, as Derek has alluded to, and he has a presentation for us this evening. It's about 25 minutes long. The way we'd like to do this is to go through his full presentation, but you can feel free to give your questions as we go along. Derek, is there any special advice you want to give about the best way to get the questions in? I think there's a number of different mediums and they come through to you. Is that right?
Yeah, I'm doing double duty as publisher and comment editor today. So if anyone, already we've got 100-odd comments, mostly people just telling us where they're from. We can't display all of those, but people can, we encourage people to share their comments and their questions throughout the broadcast. Questions, though, if you want them answered, if they're not just rhetorical and you actually want them answered by Danielle or Mr. Colonel Redman, we're going to call him, I'm sorry, I'm calling you Colonel. If you want them answered,
okay, sir.
I've been called sir by Colonel. I'm the general now. Okay. So if you want them answered, just save your questions for the once the slideshow is over, get your questions in. We're going to do our best. We're not going to ignore anyone, but there's going to be a lot of questions. We're going to do our best to balance them out. But share your comments. Comments will be displayed across the screen. But the usual caveats, try to keep them clean. This is a family show. If they're too long and take up too much space on the screen, I don't care. If it's the 95 Theses, it's not going to get shown. But yeah, we encourage people to participate and be interactive in this broadcast as much as they can.
That's perfect. So yeah, if you can keep them, I know none of us are on Twitter anymore, but Twitter length, then you have the greatest likelihood of them being displayed on the screen as David Redman is talking, and then also we'll be able to get those asked at the end. So without further ado, let me hand it off to David Redman. There was a little bit of a private joke you saw there, because my husband is in the reserves for the Canadian Armed Forces, so I always feel like I should use the honorific. But David told me if I called him Colonel, he'd call me Ma'am. So I'm going to call him David for the duration of the evening. He's prepared to take questions as long as you have them. I think the time we've allotted for this is 2 hours in total, but let's get started. Sir, you're up.
Okay, ma'am. Okay, so are we pull up the slide deck? So folks, what I'm going to do is walk you through the presentation that I've been giving to people and trying to get government to listen. Because ultimately, the only way we're going to change our response is if we get the provincial governments to understand that the way we're doing this, we should never have done, and it's time to pivot to a better way of doing it. Next slide, please. Next slide. Okay, back one. Okay, so first of all, let's get the understanding that, forward one, pandemics happen continuously. In my lifetime, there's been 4 before COVID. So it's something that's going to happen again in your lifetime, and it's going to happen many times. The response that we've done to this pandemic is unlike any pandemic that's happened in my lifetime, and I sure hope we don't do this for the ones that are in your lifetime. The second point is emergency management is the foundation to answering any emergency, not just a pandemic. And I'm going to show you why emergency management, that should have been the coordinating agency for everything we've done, clearly isn't, but should be, and why it should be. Next slide, please. All right, there's 3 types of agencies that are involved whenever there's an emergency. First of all, there's a subject matter agency. In the case of a pandemic, that's health. In the case of a forest fire, it's wildfire operations. In the case of a flood, it's the flood forecasting people. They're the people that are directly responsible for the hazard that is impacting on the communities. The second agency is the coordinating agency, and that is your emergency management organization, whether you're at the municipal order of government, the provincial order of government, or the federal order of government. And there is only one for each order of government. In a municipality, there's one. At the provincial order of government, one. And at the federal order of government, there's one. And that way, that agency is trained to handle any emergency, coordinating what the needs are of the subject matter agency and bringing all the other supporting and logistics agencies together. And I'll show you that clearer in a few minutes. Next slide, please. So I need to say right from the start as well that a pandemic is not a public health emergency. It's a public emergency because the pandemic affects everyone. Next slide, please. I'll show you this in detail here. So it's hard to see, but if you see all of the tubes in the background, they say energy, agriculture, health, transportation, education, infrastructure, ICT, finance, small business, tourism. All of those tubes are where all of our private sector, public sector, and citizens live and work every day. You fit into one of those tubes, or there's more than that. There's tubes off to the side. But all of us live and work in one of those tubes. And it's important to note that those tubes work independently, and they work really well until an emergency hit that affects them, or more than one order of government. So as you see at the bottom, as you work your way up to the municipal order of government, when a municipal order of government is affected by an emergency that cuts across all of those tubes within a town or a city, they need a coordination to be able to respond to that. So if there's a very localized flood, the little EMO that's in that town takes over, works with the mayor, and makes sure that all of the support from all of those tubes comes together to affect the ones that are most affected. At the provincial order of government, here in Alberta, we call it the Alberta Emergency Management Agency, and it works every day monitoring across all of those sectors of our economy, and monitoring all hazards that may be impacting our province. And they're watching for when either more than one municipality or more than one sector is impacted, and that's when they come into action and work directly for the Premier to try and pull together all of the support out of every one of the tubes in order to support the subject matter expert, in this case health, to handle the entire emergency. This structure lives and exists every single day. Next slide, please. So that's the process we've got, and that's the process we should be using in this pandemic. We had pre-written pandemic plans. We had them in every single province in our country. We had them at the federal order of government, and to some degree, there's even portions or annexes in our municipal plans. And we wrote those plans based on really hard lessons learned from the previous pandemics, 4 in my lifetime, and we put all of those lessons learned into the exact goals and the outline of those plans. Now, the one thing I really want to emphasize is things called non-pharmaceutical measures. And they're the things that we've come to understand in the one-word lockdown, but they're not one thing. There's actually about 15 or 16 of them. Next slide, please. Non-pharmaceutical measures include things like hand hygiene, isolation of sick individuals, surface cleaning, face masks, avoiding crowding, travel advice. And then you see all the other ones that I've shown in red on the slide: contact tracing, quarantine of exposed individuals, work measure closures, the quarantining of exposed individuals, particularly important. The ones shown in red are found to be ineffective in controlling the spread of a disease. And they are particularly concerning because they can cause extreme unintended collateral damage. And so you only use them if you actually read the WHO document that was prepared in 2019 that gathered all of the best practices from the whole world together and put it into that document you see on the left. Those non-pharmaceutical measures were listed with recommendations of when they should be used and when they shouldn't be used. And the red ones should only have been used as an extreme last resort. And the people that wrote that document, in my opinion, never ever conceived that more than 2 or 3 of these would probably ever be used. And they never envisioned that they'd all be used at once. But the recommendations regardless are, you only use them as the last resort. Next slide, please. So here in Alberta, we have a pandemic plan, and there are 4 very clear goals. And so you can see each of the goals on the screen. Sorry, we've lost the 4th goal. If we can just drop down the banner so everybody can see. Thanks. First one is controlling the spread of the influenza disease, reducing illness and death. The second one is mitigating societal disruption. The third one is minimizing adverse economic impact. And the 4th one is supporting an efficient and effective use of resources. All 4 goals have equal weight. Next slide, please. So the purpose of writing that plan back in 2014 is the most current version, but they're updated every 10 years. And I was part of the writing of the plan in 2005 that became the 2014 plan. The reason we write them in advance is so that very quickly that plan could be taken, could be adjusted for the exact disease that's hitting our province, and it could be issued publicly as a written plan. And the reason you do that is so that everyone in the province and everyone in each of our provinces can see the whole plan. They understand their role and they know exactly what's going to happen. They can see the phases, they can understand what the triggers are to move you between the phases, and they know how they fit in. That means your plan is coherent and the things that you do are coherent. The other key point of that is the written plan then gives the requirement of due diligence, where the government then, if required, can declare a state of emergency, not public health emergency, a state of emergency, and in the worst case scenario, could limit some Charter of Rights freedoms. But to do that, you have to have done the due diligence and explain clearly what your plan is and why they are required, how long they will last, and when they'll be lifted. In my opinion, this simply has not happened. Next slide, please. All right, so I put it to you that I believe in every province in Canada and at our federal order of government, our COVID response has been totally incoherent. And you see it reflected every night. You see changes. You see things happening where one side tells you that you're allowed to go skate on the hockey rinks again, but somebody forgot to tell the municipal order of government, so the rinks are all closed. Nothing is being coordinated. No one's working across all the tubes in the sector. The coordinating agency has no role in this pandemic. It's all being run out of the Ministry of Health. Worse than that, I feel that the focus on case counts has led us to even fail at the first objective, and I'll explain why I believe that. Next slide, please. The first thing you do when, as an emergency management organization, back in February, for example, being very specific to this, you look at the hazard, and the hazard is this pandemic, this virus. And we knew in February that the hazard was affecting people over the age of 60 with multiple comorbidities. The data coming out of China, and I didn't trust the data coming out of China, to be honest, but coming out of Italy and Spain and all of the other countries, Japan, South Korea, the people who were most at risk, everybody's got a certain degree of risk. We live with risk in everything we do.
Sorry, David, you've been frozen for a little bit here. So if you want to maybe fix that, and Danielle can just maybe Danielle just kind of sum it up and kind of go through some of the comments we've had so far while you unfreeze yourself.
I should just tell you, David, that we've been able to hear you clearly. It's just that your image is frozen. So he's just going to restart and come back on. So I think part of what you're hearing is for those of us who lived through a couple of crises in Alberta, like the floods of 2013 and the Fort McMurray fire, I think what he's describing to you is very familiar to all of us. I think the key point that he's making is about having this central coordinating agency, and that function is completely missing, which is why you end up with no coordination between any of the different departments that are the implementers. And it also sounds like, from what he's saying, without having that coordinating role, you're not getting the impact, the feedback coming in also. I thought it was really interesting for him to point out that you have to demonstrate due diligence before you leap to proposals that end up violating people's rights. And that step has been completely missed. The question I keep seeing coming up the most is, what is Jason Kenney's response to this? And I think that's, but we'll be able to talk to David about that in the question and answer session, because he he CCs me on all of the documents that he sends to the premiers, but I don't know that the premiers have had much chance to respond. I don't know that they receive it at all. So I'm just going to zip on over here and look at some of the comments here that you've got. I do have somebody saying get rid of the message banner. So I don't know, Derek, maybe we can save the message banner until the end. I don't know. We'll see if others are wanting to, maybe the comments can come in at the end.
I've seen those, but you know, it's our show, and okay. we want it to be interactive. We try to make it not too distracting, but
you got it. No problem.
I know some people don't want it, but we're going to keep doing it.
Derek, you're the boss. I just have a few people who are saying that, so I thought I'd mention it. Tell me when David's back, because I can't see the screen.
Oh yeah. No, I certainly didn't mean that to you. I know we're getting complaints from some people with the messages coming up. Okay. But it's kind of the format of the show. We can always review it.
No problem.
But yeah, we'll have David Redman back, I think, soon. But you know, if you want to maybe go through. Sure. I'll
go through a few. Just stay in my ear because I'm looking at the screen, and so I can't see the screen when he returns. But Nancy says, thanks for your voice of reason, Mr. Redman. May our elected representatives listen to your reasonable and common sense recommendations. Hopefully more Albertans will get in touch with MLAs and demand a different approach. We also have somebody wanting to send the documents. I don't know, a couple of questions about whether this will be posted afterwards, Derek, so we can get to that also towards the end. I have another one as well talking about asking questions about, has anyone done the valuation of all cause mortality in affected countries and compared countries with lockdowns and those without. I know that David Redman has been collaborating with Ari Joffe, and Dr. Ari Joffe has done some forward-looking estimates of how many all-cause deaths we're going to have. This is part of the problem. The COVID deaths are immediate. The long-term deaths associated with the downturn in the economy, the deaths of despair, alcoholism, suicide, untreated cancers, and other illnesses, that'll take a number of years for it to play out. So in some ways, we're looking at yet another projection, and we won't really know until after the fact. Patricia likes what she's hearing. Logical presentation so far. Thanks for that. Another person here says, provincial law does not supersede federal law, correct? Why has the health minister not been charged with breach of the criminal code? There's a question there. At some point, there may be some kind of reckoning that happens. Derek, how are we doing? Are we still working on getting David on the line again?
Yeah, I've actually got him in my other ear right here. He's just having some technical troubles, but he'll be back soon.
Okay.
He just said 3 minutes.
3 minutes. Okay,
3
sounds
minutes.
good. Another one here is they want us to see the slides through, and we'll get involved after. Sorry, guys. Like, there's a whole pile of comments that are coming in here. I think one of the things that we'll talk about after we've finished listening to the presentation is to get some thoughts. And if you have some, I think this is important because it's nice for us to get the information. And David Redman mentioned that he's done probably 50 interviews since his first one. The first time I saw him was with Peter Sean Taylor in the C2C Journal. So if you want to look that up, it's an excellent a summary of what you're hearing this evening in written form. But the question is, how do you get from great information, knowing what the structure should be, to getting it adopted by government? So if you have some thoughts on how you think that ought to be done, I would encourage you to send them along. I know that some of you have been very frustrated because you've been attempting to get this information to your MLAs. And we could talk about that a little bit later. We also know that many of you have been frustrated that the Premier doesn't seem to be open-minded to hearing the message. I have another suggestion for you to consider. And I think this might be another thing for us to be thinking through as we're hearing the rest of the presentation. Because as David mentioned, there is an emergency response at each municipality as well. When you get into a local emergency, they activate, and then when they get overwhelmed, they go at the provincial level. And I would contend that part of the reason, maybe most of the reason, why we have a province-wide lockdown right now is because of Mayor Naheed Nenshi in Calgary and Mayor Don Iveson in Edmonton, who have been pushing the government to go for more and more restrictions. And so rather than just have Calgary and Edmonton singled out, they've ended up doing a province-wide closure. Many of you got in touch with me, and you can even go online and look at the Alberta relaunch map. There's a lot of places in Alberta that have 0 cases, or certainly below the 50 cases per 100,000. That was the initial benchmark for when we started having the open versus enhanced versus the highest category of restrictions. Now all of us are in the highest category of restrictions. So I just plant the seed with you to consider that this is an election year for municipalities. This is an election year for those municipal leaders. That, I think, is where the pressure point is likely to be the hardest. If you look at what Wheatland County just did, they passed a motion saying that they're going to reduce the restrictions in their own territory. I don't know if they're going to act on that. I just saw the story today. But that is part of it. If there can be some measures, going back to what Dr. Dina Hinshaw put out there as the original benchmark, which is 50 cases per 100,000. If you're below that, you should be open. And so going through, and I know that doesn't help Calgary and Edmonton. Sorry about that, guys, because I think Calgary and Edmonton will have zones that are in that situation. Because it's one big city under one authority, it's going to be pretty difficult to get them to move until they have dramatically lower cases. But that could be the measure, is that if you start putting pressure on your municipal councillors, start recruiting people who are going to run for municipal council, who would take the approach that they would do exactly that. Because if Nenshi and Iveson were able to push the Premier in one direction, surely the other 363 municipalities in Alberta should be able to push the Premier in the other direction. So I put that out there for you to consider. If you have some other thoughts that you want to put on the table, then I encourage you to do that too. All right. How are we doing, Derek?
Well, a bit more tough than was expected. We're working on bringing Mr. Redman back here. Although I wanted to ask you, I know you've had Mr. Redman on your previous show with QR77 a few times. I wanted to ask, maybe you could tell our audience why it is that we feel it's necessary to have him back on this platform for a more extended interview this time.
Well, I think one of the main reasons is because of his extensive experience in emergency management. And it really clicked for me because, as you know, I had a chance to see an emergency operations center in action in High River. And so I observed what he's describing about the coordinating agencies. And it's kind of odd to think about it, like put it in this perspective. What would have happened during the Fort McMurray fires if it had been the head firefighter who was in charge of managing the entire coordinated response? Like, it's sort of baffling to think that they would have done anything like that. And yet that's kind of the approach that they have taken here. They've put sort of the doctor who should be responsible for one part of the response, managing the whole response. Like, what does Dr. Dina Hinshaw know about how many kids should be on a skating rink in Calgary? What does she know about how many people should be allowed in a grocery store, or how many people should be, or whether recreation centers should stay open? Like, this is part of the issue, is that you need to have content matter experts feeding into the process. So I think that's important. One of the things that we need to get into, though, is what does a more balanced approach look like? What does focused protection look like? Because we know we've got two levels of seniors who are most at risk: those who are in long-term care. In some ways, that might be the easier area to protect. But the other side is that we have a large number of seniors who are living in their homes, in their communities, and we have to make sure that we have a level of protection for them as well. So how do you find that balance? And we'll get into that. Am I hearing David back?
Yes, I am, ma'am.
Okay, you're off. I filled some time just reiterating some of the things that you said.
Absolutely.
And then and you heard where I hope we can go when we get into the Q&A. Let's get back to your presentation. Here's what I would recommend, though, David, is that if you freeze again, if we can hear you, let's just keep on going and not worry about your video. Okay,
works for me.
Go ahead.
Okay, there we go. Okay, so what you can see on this slide is we knew in February. So if you can go to the next slide, please. This is March, and every week, who produced the data? And so again and again and again, what we saw coming at us in February and early March was that 95% of the deaths worldwide were in people over the age of 60 with multiple comorbidities. And just to be real clear, they were seeing 3 and 4 morbidities in very old people. Next slide, please. So what we should have immediately done is found a way to protect concentrations of our seniors over 60 with comorbidities. And to me, the very first thing that came into my mind in March was our long-term care homes. If we could have protected them, we probably could have saved a lot of people. So we know to date in Canada, 96.1% of our over 21,000 deaths have been in seniors over the age of 60 with multiple comorbidities. That's 20,000, almost 21,000 of our deaths, and that's reported daily. Next slide, please. The flip of that, of course, is that people under 60 who don't have 3 or at least 2 comorbidities are really at very low risk from COVID. The same stats are here in Alberta, 94% of our deaths, over 94%. Next slide, please. And just to emphasize the point on comorbidities, if you look at it on the left, over 70% of the people in Alberta who have died have had 3 or more comorbidities. These are people who have severe heart conditions, severe diabetes, severe cancers, all together before COVID hit. Next slide, please. So the whole point is, out of the over 21,000 deaths, 15,800 of these because 73% of the deaths in Canada, 73% happened in long-term care homes. So if you protected the long-term care homes, and when I say quarantine, I mean both the staff and the residents, and I don't mean in a draconian-like lockdown, but I mean the staff can't go home at night. They live in a government-provided hotel, they have their meals provided, they move back and forth to the long-term care homes, they do a 30-day shift. One example, they do a 30-day shift and then they go home to their family. They quarantine in advance for 14 days and then they go do a 30-day shift. For those of us in Alberta, that's how the oil sands has been working for the past 2 decades. It's not inhumane. And as well, what you also do in that quarantine center is you bring entertainers in, quarantine them for 14 days, and then they can go to the long-term care homes and be available to the residents. Other people that are bringing social services, other people that are bringing methods to communicate with the families. So you do it in a very humane way. And unfortunately, in Canada, we ranked last in the developed countries of the world in care for our seniors. Next slide, please. So yes, it might have cost a lot of money, maybe $2 billion, but instead we chose to try and use non-pharmaceutical methods to lock down our whole society, and it obviously didn't save our seniors. We killed 20,000 of them, and over 15,000 of them in our long-term care homes because we refused to quarantine the long-term care homes. We spent over $400 billion trying to tell people who were well to stay home, never envisioned in the non-pharmaceutical uses prior to the pandemic. Next slide, please. We didn't have to follow the very failed practices of China or Europe, in particular Italy and Spain, which were all happening in March. Instead of doing what they did, if we had just quarantined our long-term care homes and then had the time to look at those other people who were over 60 with multiple comorbidities that were living out in society, not in long-term care homes, we could have offered many solutions for them as well, and we can talk about that later. Next slide, please. The other point that we constantly hear is that we have to protect our medical system. 71% of the hospital beds to date and 65% of the ICU across Canada are filled with people who are over the age of 60 with multiple comorbidities. If we had handled that issue, there never would have been a challenge in our hospitals. But if you do believe you need surge capacity, we should have been looking at surge capacity for our hospitals, both in terms of infrastructure and staff, back in March. Next slide, please. In my opinion, we have completely ignored the other 3 goals that were written right into our pandemic plans. By ignoring those goals, we have caused massive, massive collateral damage. Next slide, please. We see it in the papers every day. The societal fabric, just simply trying to move between provinces. Nobody trusts each other in our next door neighbors. Our mental health, we're seeing reports on mental health. The Chief Medical Officer of Health of Canada back in January said it's crushing our mental health system. These problems are going to last for at least 2 decades. We made them by inappropriately using non-pharmaceutical interventions when we never should have. And even worse, we knew before they wouldn't stop the spread of the disease. That's why they weren't recommended in 2019 in that very extensive WHO document. But one of the bullets on this slide that I can't miss, and I definitely don't want to miss, is our children's education and socialization. I have 6 grandchildren, all teenagers in junior and senior high. The impact of this on the education of our children will also last us 2 generations, their generation and their children's. What we've done is we've stopped the socialization and we've taught our children that what do you do in an emergency? You hide. And it's exactly the opposite of what we had planned to do. The final bullet is our economy. And for anyone who doesn't think that spending over $400 billion in our federal budget, plus all the additional debt provincially, if not almost doubling our national debt in less than a year, if people don't think that's going to have an impact on our healthcare system going forward, someone's got to pay the taxes to service that debt. It's going to be monumental, and it's going to last at least a decade, if not longer. Next slide, please. The real tragedy of this, if you can make that slide bigger in particular, there have been study after study in the last 4 months that have showed over and over and over again that non-pharmaceutical methods that we now call lockdowns have had no impact on the spread of the disease. The virus continues. It's a seasonal virus, and it continues exactly the same whether you try and lock down or not. We've seen it all through the northern countries of Europe and through our countries here in North America. The curve is identical to the seasonal curve, and this is a peer-reviewed study that said that absolutely insignificant, the difference between the countries that didn't lock down and those that did. They studied complete non-lockdown countries and compared them to lockdown countries, and you can't see a tiny line, a difference between the two lines of the two countries in terms of the spread of the disease. And I'm talking about the spread of the disease, not the deaths, the spread of the disease. Next slide, please. It's a lesson that we've had to relearn the hard way yet again, and we'd already learned it so many times before. So how do we get out of this? People want to know, how do we get out of this? I give you these following bullets. First, we need a comprehensive 4-goal plan issued by every one of our provincial governments and our federal government. It should show us what they're doing, why they're doing it, and show us the triggers between phases and what the phases are. Still to this day, bullet number 2, vigorously protect the most vulnerable. Those are the people over 60 with multiple comorbidities and the others with severe comorbidities living in our communities. And there's many ways to do it. If you bring the Emergency Management Agency in, they would have developed a plan for the long-term care homes within 36 hours. They weren't included in the problem, and so we had outbreaks. At one point in time in Ontario, just in January, 40% of long-term care homes, halfway through the second wave, were having outbreaks. That's unconscionable. If we had isolated them and put them into a caring and compassionate quarantine, we could have handled this issue. Third, we got to make sure all our critical infrastructure is protected, not just our medical health care system. Go forward to slide, please. One more. Okay, 4th bullet, we've got to remove this campaign of fear. And I constantly see, instead of ramping down, as the curve is going down, as we should have been opening up, we shouldn't have ever been closed. Let's put it that way. But right now, I can't understand why we're not reopening up. The curve is going down just like it does seasonally every year. But catching COVID is not a death threat except for those people in the first 2 groups. Yes, some people will die, but people take risk every day. The chance for a 20 to 40-year-old person to die of COVID is 5 times, it's 5 times greater chance of dying in a car accident driving to work. You got to put these things in perspective. We take risk every day. We've got to remove this campaign of fear. We've got to put COVID in context with all the other risks we take in our life, and we've got to get on with our life. Next slide, please. We got to talk the end of future lockdowns. We're not going to go back to non-pharmaceutical methods. The science, if you actually believe in science, has proved there's no difference between lockdown and non-lockdown countries in the spread of the disease. So to try and tell a 20 or to 40-year-old that they might catch a disease and it might do horrible things to them is nothing but a campaign of fear, which actually has no impact because their chances of catching it are the same in a lockdown or a non-lockdown country. We've got to guarantee that our schools are going to stay open and our daycares are going to stay open with reduced social distancing because we're impacting the psychology of our children for generations to come. Anyone who's under the age of 60 without pre-existing conditions should be allowed to go back to work if they're willing and able. And then continue to vaccinate as vaccines come available. It's going to take us at least to the end of March to vaccinate all our seniors that are in the long-term care homes. And we have to make sure we take care of them first, plus those other people who have serious comorbidities in our society. But we don't need to wait till April to do it. We need to quarantine them now and then allow them back into their society. Next slide, please. This is a cartoon that represents what a teenager in our province thinks of what we've done. The whole talk, we've got to protect our medical health care system, but everything else around it is not important. We followed the wrong practice. Non-pharmaceutical interventions should only have been used as a last resort. COVID-19 is deadly, in particular. 96.1% of deaths in Canada are in seniors over the age of 60, and in Canada, the average age of death is 84 with multiple comorbidities. It's simply not to others. It's less than 4% for people under 60, and the largest group of that 4% are in fact people 59 to 60 with multiple comorbidities. Next slide, please. So folks, that's my position. That's what I've been trying to tell the premiers since April. I've been sharing with them, I've been writing to them, I've been trying to get them to understand what's going on, and to a stunning silence. And so I stand ready to answer any of your questions.
Well, I should mention briefly, David, the problem we had bringing you back in. I think we've solved that. So if you do want to fix your frozen screen, I'm not deathly terrified that we're not going to get you back anymore. I was freaking out that Danielle was going to have to read the rest of your slide and then we're going to be a bust. But if you want to try and unfreeze yourself, I have a reasonable degree of confidence.
I will. Danielle, unmute and cover me for a minute.
All right. Well, I think Danielle's got a lot to work with there to cover for a minute. Hopefully not much longer than that.
All right. So Derek has been putting a lot of comments on the screen, and he'll keep on doing that. But I'll tell you where we're going to go with our discussion. I think we have to have a greater, deeper conversation about what it actually would mean to lock down the long-term care facilities. Because my sense of it, and I don't know if we have any long-term care facility workers on the call, but if we do, maybe you can tell us whether you think your colleagues would be open to what David Redman is suggesting. When I was on the air and this was posed, I got feedback saying that those who are serving on the front line are so terrified of being the one to bring COVID into the facility that they would welcome the opportunity to be 2 weeks on, 2 weeks off, or 1 month on, 1 month off. And so that was one perspective I got. The other perspective I got was there's no possible way, especially if you've got individuals who are principal providers of large families, because as we've heard, many of our frontline workers live in multi-family homes, and as a result, they may have other obligations that for aging parents or for young ones that prevent them from being able to be locked down for a month. So is it even practical to consider that? And then I think we do need to explore some of the ideas around what do you do about those who are not in a care home. I must tell you, I have the healthiest 86 and 96-year-old people listening to my show because they did send me texts all the time telling me that they were in their homes and they were wondering when they were next up for the vaccine. So we do have a large number of relatively healthy seniors who are still independently living. And so how do we make sure that they stay protected? So Derek, do we have David back yet?
Yeah, David's back. He's. I thought you could see him. Sorry, he's right beside you.
Beautiful. No, when I go over to the chat,
he's right beside you, ready to go.
Okay, let's go. So David, let's begin with that because I think that there has been your proposal's been mischaracterized by those who don't want to listen to you. I think we both know that. But how do you answer this question about long-term care, that what you're proposing is just not practical, that the staff would never agree to it, the unions would never agree to it? You couldn't possibly have that kind of rotation with this particular employee group.
Okay, first of all, I don't believe that to be true. And I give you one example. It wasn't in Canada, it was in France, where the staff in the long-term care home in France, right in one of the biggest epicenters of where COVID was outbreaking in France, and we know France had a horrible situation, they simply decided themselves they weren't going home. So they had mattresses delivered, and they moved in with their patients, and they stayed there for 47 days. They had entertainers quarantined and brought in. They had multimedia devices brought in. I think you would have found that a lot of the staff in our long-term care homes are just as dedicated to their residents as those folks were in France. So let's start with the first wave. First wave was short, and was a seasonal decline happened, and we all saw what happened in the summer. And so I think, first of all, you offered the opportunity to the people that are working in the system, and I think you would have found many of them would have volunteered. If you didn't have enough staff to do it, then you put out the call, and I think you would have also have found many people in the community willing to come in and participate, as well as some of the family members who may have been willing to quarantine into a government-provided facility so that they could continue to provide that daily care to their parent or their loved one like they had been doing before. The offer was never made. The other thing that you do, when you run one of these process, it's not emergency management. Emergency management runs the process. They would have brought in the unions, they would have brought in the owners of the for-profit, not-for-profit, and publicly owned, and they would have had this discussion with them and brainstormed all the possible options, and in 36 hours would have presented a series of options to the Premier saying these are the things that we believe are possible. Then it's unconscionable to me that once the first wave is over, that we wasted all 4 months of the summer doing nothing. We knew this was going to come back. Anyone who's ever studied seasonal viruses knew that the middle of October, this curve was going to go up exponentially, and it did. And we also know that it peaks in the second week of January and starts coming down. Now, it's not going to go all the way back down to zero like it does. That doesn't happen until May. It's going to come down a lot, flatten off, and then drop off. So in that summer period, we should have been developing full options for the care of our long-term care homes. We should have had all the time to have all of the detailed discussions about extra funding, about whatever we needed to do. And further to that, we could have developed an idea of consolidating perhaps some of the long-term care homes, but as well opening up new facilities that would have been able to take in the seniors that were living out in the community, if they so wished, into a similar type of isolated quarantine system, but in a really nice situation inside of something like a hotel or whatever else with staff provided in it. We had 4 months to figure this out before the second wave hit. And then we see the massive outbreaks in our long-term care homes again, because we simply decided that if we locked down all of society, somehow COVID wouldn't get in there, and yet the staff went home every night. It's unconscionable.
So tell me how we deal with the multiple family obligations, because we do know that there would be a lot of women who probably are moms and have kids at home, and we know that in our cultural communities, it's part of their culture. I've interviewed many from the South Asian community, part of culture to have their parents or grandparents living with them as well. It becomes really difficult if you take that core person out of the mix of that family dynamic for an entire month. So how do you address the fact that they've got home obligations and that may cause them to be reluctant to go into lockdown for 30 days? I mean, it's different if you're a guy working on the rigs or working up in Fort McMurray. You've kind of bought in knowing that that's what the job is. But those who decide to work in long-term care, many of them have multiple jobs and these other obligations. So how do you try to address that?
So some of those people wouldn't be volunteering or be able for that type of a process. So that's where you have the whole discussion about surge capacity. That's where you look at other people that are out in our community that would want those employment jobs. And in particular, you have the ability to do rapid training for people that volunteer for the process. You bring other people in. You don't just say the people that are there have to stay there. You look for all the different ways you can bring more people into the solution. And you definitely want to build a surge capacity, because there will come a point in time where some of the staff get sick regardless of what you do. And maybe not from COVID, but too sick that you don't want them working in the long-term care home from pneumonia or some other type of illness that they catch. So you got to have standby staff that are living in the quarantine center that go in. The challenge is, if you don't even consider it, you won't come up with solutions. And so, yes, those people that are primary caregivers and were not prepared to leave for either a shift. Okay, but let me, just jumping back into my head, one of the things that I always talk about as well is, right from the very start, in February, one of the first things that the federal government should have been focusing on was rapid testing. Somehow now we're hearing, oh, the federal government's got lots of rapid testing. Well, that sure wasn't the case back in March, April, May. The federal government simply said they weren't reliable enough. They weren't investigating them. Yeah, now they say there's lots available that the province hasn't used. They didn't even improve them till December. Rapid testing has been used around the world in other situations. If you have a rapid test and it's even only good for 4 hours, that long-term care home staff could come in the morning at 7:30, be tested, wait 5 minutes, you're good until noon. They can then go back, be retested at noon, finish their afternoon shift, and go home. If we had put rapid testing in place, especially through that great gapping 4-month period in the summer, and found some that are effective enough, we wouldn't be having this discussion at all. We never had that discussion because people that were presenting those types of ideas through other agencies other than health said, we're not interested. They're not as good as the test we've got. Well, I'm sorry, you've just denied all those other tubes that are in our society the ability to work in perhaps a more safe manner. But I do want to come back to the fact that there's lots of seniors living in the community who simply, the recovery rate for seniors over the age of 70 who don't have comorbidities is almost as good as those people who are 40. It's the comorbidities attached to age, and in particular, multiple severe comorbidities. But you won't hear health saying that. They keep saying anyone can die of COVID, and they're correct. Anyone can. But the risk of dying of COVID or dying of heart disease for someone between 20 to 40, 4 times greater of dying of heart disease. So yes, anyone can, but you can also die in a car accident, 6 times the chance. We've got to put things in perspective, and we're seeing that's intentionally not done. Instead, we're seeing campaigns of fear saying, if you catch COVID, it might have long-term effects later in your life. Yes, every disease could do that, but the risk of it is tiny.
Let me ask you about this, David, because I'm beginning to now understand how it would work. When you're trying to manage the crisis, the 30 days on, 30 days off may have been the way to do it. Now we have other alternatives. Now we've got rapid testing, which would mean we wouldn't have to quarantine staff necessarily as well if we deployed that. Okay, I'm getting you. Now, let's though talk about what the powers are in an emergency, because this is what I've feared all along. I've had this sense that nobody wants to upset the unions, that, oh my gosh, you can't manage this way because you can't bring in people who are not unionized into this environment because the AUPE will grieve it, or the Health Sciences Association, or the Nurses Union. Like I get the sense that in some ways collective bargaining agreements are stronger than the Charter of Rights and Freedoms. And so what am I missing here? Why is it that everybody is tippy-toeing around trying to make some of these decisions that can solve the issues that you're raising in the way that you've described?
I can only take you back to the discussions I had during counterterrorism after September 11th. I always found, and I was one of those guys that ran these huge groups and ran them through the emergency management process and pulled ideas out of them. If you bring people in at the start and they feel that they are part of the solution, you can get rid of a whole bunch of these concerns right at the beginning. And I believe that by excluding the unions, by excluding the owners, by excluding people all the way through this process, we've seen every one of those tubes excluded except health. If you bring people in, they will give you solutions. You don't throw the solutions at them. The emergency management process is bringing all the experts in and saying, how can we do this? And they provide you solutions. When we had the outbreak of mad cow disease, we brought in the owner-operators of the feedlots, the owner-operators of the cow-calf. They had amazing ideas. You don't exclude the people that are in the actual business. They come up with the solutions, and you actually bring in some of the workers in each type of the field, and they can tell you how things could be done quicker or easier, and maybe wouldn't require someone with all of that training, but maybe they could be trained much quicker if they only did this portion of it. Those are the types of ideas that have been simply ignored.
Well, it's actually, it brings it into clear focus as well. If you hire somebody whose job has principally been to protect Alberta Health Services and hospitals, I guess it's not really much surprise that all of the messaging has been around, we have to protect our healthcare system to the exclusion of everything else. And so now I guess here's the question. How do you move from the situation we've got ourselves into the structure that you're describing? I mean, one of the things I noticed when I saw emergency response is that there are different periods. There's sort of the critical 48-hour periods, and then you're into another zone where you're doing your repair. But you ultimately move into recovery. And we don't seem to be talking about When do we move into recovery and hand off decision-making to someone else? Is that the next step? And how would you even do that transition now that we've got so locked in to having Dr. Dina Hinshaw at the helm of all this?
To me, that is the challenge that started in February, because the very first day you recognize that there is the potential for an emergency, and we didn't declare here till the 15th of March. All the time up to then, what we should have been doing is going, the worst case scenario is this is coming here. Mm-hmm. We see who's most at risk. We develop a plan for that. But the minute you admit that there's a probability that this is going to come to you, remember that written plan I told you? Right in that written plan is all the phases. And the phase of recovery is written right into that plan. And you have a team starting, led by emergency management, working across every sector of your economy, developing the recovery plan, and you issue it. There's annexes to the main plan, one for long-term care homes, one for the actual hospitals, one for our energy industry, one for our livestock industry. And we'll talk more about livestock. Don't let me forget to come back to livestock and transmission of virus. But what we've not seen is all the auxiliary plans, because we never had the first plan. But yes, if I was running emergency management in March, I would have taken one of my best planners, and they're actually planners, they're experts in running the planning process, and said, tell me who you need to write the recovery plan. And I would have, how do we get out of this? I mean, how do we shift? It should be the Premier with an emergency council, which is made up of the key ministers and their deputies, with the emergency management agency working as the coordinating across those probably 10 or 11 ministries with the deputies. And you say to the deputies, I need a person who's an expert in this, this, and this. They're going to go work on the recovery team. And you look at each one of the deputies and you tell them the expertise you need, and the deputy provides that staff to you. And they go up and they write the recovery plan. That recovery plan should already be written. I'm hoping it is, but nobody's talked about it and nobody's heard about it, at least in Alberta. That should have been written in March, because the hardest thing to do, especially if you go too far into something like a lockdown, is deciding what's the mechanism to trigger the stop without losing face. Well, I don't think we should ever have gotten into this situation, but now, if the premiers in each of the provinces don't reestablish and stop, they form these special councils or these special war rooms or these special, it's not the deputies of their departments, it's these outsiders that they brought in and put in the little group. I would have brought some insiders in. I would have brought in the Alberta Electric System Operator, the head of it, and said, I need you here because I don't want the power grid to go down. I would have brought in a couple of people for natural gas distribution, but they would have worked inside one of the planning teams. The actual council should be the deputy ministers and the ministers of the 10 or 11 or 12 critical departments, and on a daily basis, the EMO briefs them and the Premier on what's happened in the last 24 and what's going to happen in the next 24.
So,
all the sectors.
So having made the error in calling this a public health emergency and putting a doctor in charge, instead of calling it a public emergency and putting head of emergency management in charge, what is the mechanism for the Premier to take this power back and to reassign the roles? Like, I get the sense that he feels powerless now, that he's got to wait until Dr. Dina Hinshaw tells him we can move on to the next step. At what point do the politicians step in and say, no, we're moving to the next stage? And is there even a mechanism for that?
Okay, so regardless of the province, the Premier's in charge. And so to say that any person working in the civil service isn't accountable to the Premier, in my opinion, just means lack of leadership. The Premier can immediately say, today is the day we pivot. He reestablishes a new emergency council based on the deputies that the EMO probably tried to suggest to him back in March. I don't know if they did or not, but they should have. And if not, he should have turned to them today and asked the EMO, what should my emergency council look like in terms of which ministries? With that in place, and that would take less than 20 minutes, you then establish that council, and the EMO says, okay, that 8-point plan that I had, the last 2 slides, first we're going to make sure that we've protected our seniors. Second, we're going to make sure that we put in place the system to ensure that all our other critical infrastructure is taken care of. He's going to turn to the Public Affairs Bureau and say, work with the EMO to ensure that we have confidence-based messaging. And in my slide package, it's about 2 slides down, there's a complete list of what that would look like. The Premier has the tools, he just has to take charge. And very quickly, within 2 or 3 days, you should never see either the Minister of Health or the Medical Officer of Health on your TV screen. It should be the Premier, personally, with the speaking notes from across all those departments saying, this is how we're moving forward now. It shouldn't be a daily brief by the MOH. It should be a daily brief by the Premier until we walk our way out of the emergency.
All right. Laura, I know, is keeping track of when these emergency orders end, and I think they were supposed to come to an end today. Do we know if they renewed the emergency orders or have they expired? Do you know the answer to that, David?
I don't know, but it's not important because you can cancel an order at any time.
I'm just wondering if they renewed it. If they renewed it under this existing model, then it's locking down to continuing to keep Dr. Hinshaw in charge of making the decisions. Let me ask you one more aspect to this, though. So I have this suspicion, I don't know if it's true, I'm just going to put it out there, though. I have this suspicion that the federal government has put pressure on our Premier. He did a 180 in November, and it was so out of character, and I don't know all the reasons behind that, and then he has just been locked in to the position that he's taken since then. I thought he was very reasonable and very balanced up until about mid-November, and I don't know what happened. But when you start hearing the problems that we're having with vaccine procurement, the danger of not getting our fair share, the threat of potentially having the federal government step in with an emergency response of its own and declaring a federal order, the fact that they're jailing people at the airports for 3 days, they've demonstrated that they're prepared to take power into their own hands here, regardless of what it is that we want to do. I mean, I'm just trying to understand the dynamic that happens between the provincial and federal government. Are we even allowed to do what you're saying now that the federal government is also locked into having public health lead this?
Okay, let's be clear. A pandemic is 99.9% in the hands of the provinces. And so, in my opinion, this is up to the 13 premiers. It is their job to shift and turn. Do I believe that the federal government has taken the role of chief in charge of supporting lockdowns? Absolutely. I believe that our Prime Minister realized very quickly that handing out hundreds of millions of dollars to support the lockdown helped his poll numbers. And I also believe that he's going to continue doing that. And we saw very clearly early in the second wave, him making public announcements that the premiers had to do, quote unquote, the right thing. And by that, he meant lock down longer, harder, and faster. And then he said things like federal funding will be withheld if you don't. Yeah. So yes, I believe he became conspirator in chief later, but the problem is he had been given the model of lockdowns. And we use that word lockdown like it's a thing, but the biggest challenge that we have is to understand that those are non-pharmaceutical methods. There are 15 or more of them, and first time in history, we didn't just use 1 or 2, and we didn't just use them for short periods of time to get over a little peak or a specific problem in a school. We did it across the board. No one ever, first they were recommended not to be used. We didn't just use them, we used all of them. And it's incredible in my mind that a chief medical officer of health provincially would ever recommend that based on all the knowledge that was put into that 2019 document into every one of our emergency plans. So to be fair to the medical officers of health, it's not their job to run a province. They should never have been tasked with it. And to put the entire response to this pandemic on them in each of our 13 provinces and territories was a failure of leadership of the premiers. Once it's done, it can be undone. It's the same person that put them in charge can take the power back.
Hey, sorry, I just want to mention, Dave, you're frozen again. So
I think I'll just stay frozen because the picture of me, it looks like I care.
It looks awesome, actually.
It's an inquisitive picture.
So let me continue then in this vein of if you were in charge, because part of what I've noticed is that there's something new to be scared about every single time we find some progress in this, in dealing with this this virus and this disease. So, for instance, initially it was we can't allow our hospitals to get overwhelmed. Well, when that didn't happen, then it's, oh my goodness, we have variants. And then when, and now we're talking about, well, yeah, we can look at the stats and see that older people are most at risk, but then there's long haulers. We don't know what the long-term effects of the disease would be. And it does just seem, and now we're also being told, well, yeah, you get vaccinated, but you're still going to have to wear masks and you're still going to have to be socially distanced. And I'm just trying to understand how, if you were not a doctor and not panicked by some of these uncertainties, how do you deal with these uncertainties? Like, what if you happen to be wrong? What if you open up and all of a sudden the UK variant does end up soaring cases up to 10,000 per day and 3,500 people in hospital as they predicted a month ago? How do you deal with that level of uncertainty so that you can move in a certain direction and not find yourself facing the worst case scenario?
So let me start back with the ever escalating campaign affair, and then I'll come to the second part of your question. How do you deal with it? To me, the entire concept that we had to protect our medical system and that was the only thing. When you make an aim in a pandemic, the first aim you always have is to minimize the impact on the pandemic on your jurisdiction. So let's use Alberta as an example. The aim should have been to minimize the impact of COVID-19 on the province of Alberta. Instead, in the middle of March last year, what we heard was the aim is to minimize the impact of COVID-19 on our medical system. Totally, if you start with the wrong aim, you end up with the wrong result. But then we saw the shift in that, and the shift is now even more gone to the aim is to make sure no one catches COVID-19. Mm-hmm. The problem with that is it's impossible in a country like Canada. You can always throw up the example of New Zealand. New Zealand's an island. There's only one way in and one way out, i.e. boat or plane. Sorry, 2 ways in, 2 ways out. You don't have 30,000 trucks a day in the pandemic. And I'm not talking about pre-pandemic. 30,000 trucks a day across our border, Canada, US. And you can't stop them because we have a just-in-time supply system for all our food, for all our medicine, and for all our basic needs. If you stop those trucks, everyone in Canada dies. Your grocery stores go empty. So it's impossible to isolate Canada from the world. It's simply not going to happen. So if you build that model, and we've seen that non-essential travel represents 6% of the travel coming into our country every day. So clearly there's lots of people coming back and forth. In the first 2 weeks, you have the opportunity to use non-pharmaceutical interventions to slow the arrival. But once the disease is in your country, it's going to spread. Non-pharmaceuticals have always said they do not slow the transmission of the disease once it's in your country. And you never do things like sending people who aren't sick home because they might have been exposed. It says exactly not to do that, right? Right within those non-pharmaceuticals. The studies that we're now seeing worldwide is that, yes, it's a seasonal virus. We kind of knew that before, like definitely in the first wave. But so why was it such a big surprise in the second wave? But so if you can't control the spread, and the study that's in the slide package that studied the first wave, there's absolutely no difference in spread of case count, the great case count that we see on the TV every night. If there's no decrease in spread of case count between the non-lockdown countries and the wide open countries, then clearly not catching COVID is simply an impossible dream. And to terrify people that if you catch it, you might die, that's the most ridiculous thing. I wrote a paper to the premiers back in August and said, fear versus confidence. And I gave them how you do confidence, and it's in the slide package. It's a full slide in the questions and answers. You never talk about the fact that your hospital system is going to be overwhelmed. You talk about the fact that your hospital system is resilient, that you're building surge capacity, that you're going to segregate COVID patients, and you're going to make sure that you keep clean hospitals and COVID hospitals. You tell them everything you're doing, that you're going to have extra staff, that you're building extra facilities, but you don't think you're going to need them. And you carry on and carry on and carry on with the confidence model. You say that you've checked all of industry and it's going to stay open. You tell people, look, the chances of you dying of COVID are 5 times less than driving your car to work. And somehow the government hasn't ordered everyone to lock down in their homes and never drive their cars.
Well, it's very true.
So you put everything in perspective. The other thing you do with your hospital system, I'll give you the example of Ontario. Sorry, Danielle, for running over, but just one more idea. The hospital system at its peak in Ontario had 1,760 people in hospital, and it was presented as if this was a mind-exploding tragedy. It is. You never want that many people in your hospital, but lockdowns obviously didn't solve that. The other side of it is, did you know there's 22,338 acute care beds in Ontario? 1,760 of them had COVID patients, but the other 22,000 didn't. So if something's overwhelming your hospital system, it's not COVID, right? There's other diseases out there. Yes, your hospitals are full. They're full every November, December, and January. If you read the reports out of Sweden, particularly from the doctors that work right within the hospitals, not the Western media, they say, yeah, our hospitals are full this time every year.
Exactly.
And you know, we manage every year. And yeah, sometimes we have to put extra people here, but you know, actually this year didn't look any worse than any other year. Instead of a whole bunch of, sorry, I see the one on my screen right now about my mustache. If you see all of the reports coming out of Sweden, they just simply managed it. And they had full confidence in their medical system. They knew if they needed more, they'd make more. They'd find staff. They'd bring back retired staff. They would train some of their med students a little quicker and get them out of university. There's so many ways. You never use fear. As a soldier, I learned right away, you never let your soldiers be afraid. You show confidence and you tell them why they should have confidence, not why they should fear everything. Sorry.
So you put so much on the table there. Let me just reinforce what you said, because I had a grandma before I went off the air tell me that her 10-year-old grandson is in such a state of terror about getting COVID. He thinks he's going to die, or he thinks he's going to get it and pass it on to his family, and he's going to kill his family. And this is what a 10-year-old is being saddled with. So I just want to reinforce, I don't even think we understand what we've done to the next generation. But tell me a couple more things, because you know so much about the structure of emergency management. So Laura's gotten back and told us that the order is supposed to end at midnight tonight, unless it's been renewed by cabinet. What are the consequences of the emergency health order ending tonight? Does that mean that we can go back to saying, hey, I have no cases in my community, I'm going to see my parents for coffee? Or what is the consequence of it? Do all the health orders stay in effect even if the emergency orders expired?
Yes, they do.
Okay.
But the ones that are actually breaking charter rights and the ones that are actually inflicting some of these severe penalties on our society become less justifiable without the extra powers. And if you look at the powers under the Public Health Act, they were always designed for local outbreaks. They're sweeping powers, though.
Right.
But they were designed for where you have one community with a smallpox outbreak, or maybe two side by side. The entire concept of a provincial state of emergency, again, has sweeping powers. But when I was running counterterrorism, one of the things that I always said to the Premier at the time, that was Ralph Klein, was, sir, we will never declare this unless we actually need the powers. And if we declare it, we will state which specific powers we're going to use. Because the powers from left to right, they're immense. If you look at the public emergency, the declaration of a state of public emergency or a public health emergency, they're sweeping. In the plan, you say, if required, we may have to invoke a public state emergency, and at that time, we will state exactly which powers we're using, for how long we're using them, and what the intent of those powers are. You got to be more specific. You actually have to say which powers you're using and why. You don't just declare the state of emergency. What I've seen is it's a broad base because they don't have a plan. We're just going to have this bucket list of powers that we use, and we'll use them when we think we need them. And we'll just, surprise. To me, the challenge all along is everything is done as a knee-jerk reaction. The first closures of our schools, I can tell you this for a fact because I know people that work in the school system, They found out that schools were closed on Monday after the 15th of March declaration, the same time everyone in Alberta did when the medical officer of health made the announcement on the television at 3:30 in the afternoon, and the principals and vice principals ran like hell for their schools. Why did they do that? Because first of all, no kids were coming to school tomorrow. Number two, the teachers didn't have a clue what to do. There had never been any consultation. There had never been any discussion, at least at the school board and below level. And the challenge is, I know for a fact in most schools, it's also part of our social safety network. So the children that weren't coming to school on Monday, for many of the children, up to 1/3 in many of the schools in Alberta, it's the only place they get a noon lunch meal. And it's in some cases the only full healthy meal of the day. So those principals and vice principals had to figure out Sunday night how they were going to actually deliver lunch to all those homes under the health restrictions that had just been jammed on them for all the children that weren't coming to school tomorrow to get fed.
Wow. You've put, again, there's been a number of questions that have come up, and someone says they don't want me to leave the livestock question, but I want to ask you this other question, because I asked you about whether the orders expire after tonight. Sounds like the answer is no. The other question, though, was do the municipalities, if the public health if the emergency response has always been designed to be localized, presumably local municipalities have the power to say, we've assessed locally, we have no one in our hospital, we have less than 50 cases per 100,000 or 0 cases. We are now declaring ourselves open the way the initial plan was rolled out last summer. Can they do that? Do they have the power to do that?
No, they don't, because once you've declared a state of emergency or a public health emergency, the powers belong to the province. And you always have to remember, in every province in Canada, how municipalities are structured is different. Municipalities are a product of the province, and the province establishes how the municipalities are made. But I put it to you, when I was in EMA and when I was running EMA, at that time there was 314 municipalities covered by the Emergency Management Act in Alberta. And every one of those municipalities must have an emergency management organization. In our small communities, it's one person. In larger communities, there's a whole staff. And we worked directly from EMA to them. We had a system where we could communicate with them in less than 3 minutes to every municipality in Alberta, the emergency public warning system. We could send the information out, pull the information back. But let's take a step back. Let's go back to March again. Who should have been in the room from the middle of February to the middle of March? And I put it to you that our municipal structure, our municipal order of government was not in the room. Just like those teachers were surprised, so was every municipality in Alberta, because they weren't part of a planning team. Health ran everything. They did all the planning, they did everything, and they never considered the municipal order of government. Right at the table, and I'll go back to counterterrorism, I'll go back to the floods of 2005, which were catastrophic from Edmonton south in our province. Groups like the Alberta Municipal Rural Communities under AAMDNC and AUMA for the large centers, the large urban centers, we had the chairs of those two associations with us all through the planning for counterterrorism, all through the floods, because their job is to represent all the communities, large and small, and to share that information out and to get the ideas back. Occasionally, we would actually go directly to the mayors of our 3 largest, or the 11. Sometimes we did it with the 11 big. When there was something that we knew we really needed their input, or that we wanted to make sure they didn't feel that they were excluded from the process. How can the medical officer of health say kids can go back and skate on rinks and just assume the rinks will magically appear? The municipal order of government owns the rinks in most cases. It shows that there is no structure across all the tubes and across all orders of government that's running this process in our province. And I tell you, all the other provinces that I've done this briefing to, I get the same story over and over. You've got to include, it's a collaborative approach. That doesn't mean everybody gets an equal vote. It means somebody called the premier is presented a series of options and he says, I want option B. And that's with all the advantages and disadvantages for each option listed, so he knows exactly what he's choosing. And when you're going to talk about industry reopening, when you're going to talk about social and recreational, when you're going to talk about tourism, when you're going to talk about any part of it, you have to make sure that it's a sustainable and logical plan. And the only way you do that is bringing all the players into the room. Now, clearly, you can't have a room of 200 people. So you do it in subsets and subgroups, and emergency management breaks those out into the sub-plans under the major plan.
What do you think the structure is now? I'm like, as you're talking, it occurs to me that, and I don't want to pick on Tracy Allard because there were others who traveled over the Christmas break, but she was Minister of Municipal Affairs, and she was kind of seen as, you're not really that essential here. We've got other things that other people that are more essential to this process. You would think that she would be kind of a key point person in bringing in the municipalities, and it sounded like it wasn't necessary for her to be here, which it just strikes me as odd. So I'm trying to understand, you've described the structure how it should be, the different players who should be involved. What is the actual structure? Is it Dr. Dina Hinshaw meets with the head of AHS, and then they talk to some outside doctors telling them how fearful they have to be, and then they go back to the premier and say, you got to be really, really, really scared? Like, that's what it looks like from the outside. Is there any better process? Like, do you know anything about how the process is unfolding right now?
I don't, to be honest with you, I can't tell you how it's exactly structured. But what I can tell you is what I've been told, and I don't know if it's true or not, that the Minister of Health, the Deputy Minister of Health, and the Medical Officer of Health have an operations center that's running in the Department of Health, and that they have a sub-advisory group of about 10 people who are retired doctors or currently serving doctors, and they are the planning group for the whole pandemic.
The entire system is being run by doctors who are seeing sick people every day and don't have any outside perspective.
Or they've been brought back in on a special commission. Again, I don't know if that's true. I certainly know that if emergency management has been running the cross-government coordination and running the planning process, you should fire the head of emergency management. But I know they're not, so don't fire him. It's not his fault. This is being directed, and the whole idea was, if you need someone, health says we'll get them. Well, but they haven't. The messaging that you see every night is 100% health focused, 100% protect our medical healthcare system, and number two, you don't ever want to catch this disease, even though we know for a fact that non-pharmaceutical measures do not stop the spread of a viral disease in our community. We learned it before this pandemic, and world studies have proven that it's exactly the same thing that we knew before is true again.
Let's then go back to the point you didn't want me to leave, and someone has already mentioned, is the livestock transmission of virus. I haven't actually considered that we've had a number of emergencies based around viral transmission. Hoof and mouth is one that we always worry about. Then BSE, of course, was another. We also had E. coli and the devastation that caused as well down south. So tell me the crossover. What was the point that you wanted to raise, and what we could have learned from how we deal with agricultural viral outbreaks? Okay,
so there, also in my slide deck is what should have the task been to the medical officer of health, as opposed to, it's in the question and answer period, as opposed to the role that was forced on them or that they asked for and got. I don't know which way it happened. I don't care. One of the tasks should have been to watch for zoonotic transmission. You do that for two reasons. Number one, every virus known to man has shifted. This is nothing new. The fact that there's a South African virus, that there's a British virus, that there's a Brazilian virus, that I'm telling you right now, there's a Canadian virus. We just haven't found it yet. It's shifted here too, and they're going to continually shift. And so if the line that we're now hearing is that because of these shifts, that we're going to have a third wave this month, number one, I don't believe it. It's seasonal. But number two, because look at Great Britain, it's got the new virus and it's dropping off just like we are. Mm-hmm. But even if it does, it doesn't matter. You can't stop the transmission. They've now discovered from old tests that this has been here at least since January. So it's already out in the community.
Actually, David, if I may, I think she's traced it back to December 15th.
You're
So
absolutely
it's been
right.
here for
I
been
didn't
here
want
for
to say
2
that because I
months.
didn't have the fact in front of me, so that's why I said
Yes.
January. But it's here. It's out there. So the whole point of the two-stage process with zoonotic is, number one, the fastest way a virus can mutate is by shifting from humans into pigs, into another part of the livestock chain, back to pigs, back to humans. So we should have had the Alberta pork producers specifically in the room and saying, we're going to come out and test, because we've got a really good system in the pork system. Like there's only so many of the piglet farms that go to the fattening farms that go to the rendering site. They've got little pyramid triangles. And we could have tested in each one of those on a routine basis to see if the zoonotic transmission had gotten in. Number one, because we need to know whether or not eating something's going to make us sick, and it obviously hasn't, but it would have been nice to actually look at that scientifically instead of, surprise. And the second thing is to see if we were going to get sick, but the second thing was to watch for the shifts. And it was like, maybe it's happening, but nobody's ever told us. And wouldn't that have been a comfort thing? We're monitoring all of the different aspects of this virus. We've got it under control. We have a plan for this. We have a plan for this. We have a plan for this. If there's ever a challenge, we're going to tell you, right?
Why did you single out a pork in particular? Is there some reason why that group of livestock producers would be particularly?
Remember way back in my past life, I told you that I helped, I led the coordination of 10 deputy ministers to run what was called the mission analysis, which then ultimately broke down into the estimate of the situation, which wrote the 2005-2006 plan. In the room, I had all 10 deputies in the room, led by the Deputy Minister of Health, with me sitting right beside her. Her name was Patty Mead at the time. And we ran through that process together. And so the entire concept of all of this process, one of the things that was brought forward, that previous viral infections had a really great relationship between chickens and pigs. Now, this one, some people claim was a bat or whatever else. But a pig is the closest, I was told, I'm not a scientist, I'm not a doctor, but I was told that the pig's physiology was as close as possible to humans. And the reason why so many of these viruses come out of China is because large-scale chicken, large-scale pig, and with humans interacting on a daily basis. And what happens is the virus will jump from chickens that have a very short lifespan, and it jumps back and forth into the pigs that have a large, but the pigs can actually transmit it easiest. It's not the only way, but it's one of the more common ways that it jumps into humans. And so the virus is looking for a way to get out. It's not thinking about killing anyone. It's just thinking about surviving. And so it looks for hosts to live in. And so if it can jump from chickens, it stays in the chickens for a long time, and then it jumps over to a pig, and then that one survives, and so another one, and finally it gets to humans. That's how it was explained to me. Wow. And so in my mind, I would have said right away to the Alberta pork producers, hey, and I used to know the guy personally, the head of the association. I say, hey, let's have a talk, right? I need you to be part of this planning group, because I would have wanted the doctors there. I would have wanted because the other part of it is transportation, all those pieces. I would have brought a group together and said, we're looking for zoonotic transmission. You guys clearly have to be in the room. But I also want someone from the Cattlemen's Association, someone from the Four Feathers Association, which is, chickens, turkeys, geese, and I forget the last one, sorry, duck. Okay, so the Four Feathers Association, I would have had each of those associations where zoonotic transmission could have occurred and said, hey guys, we need a monitoring plan. I need you guys to come up with it. Tell me how this is possible. And I would have done it with all of the other experts in the room and said, okay, go away. I'm giving you one of my planning officers. They're going to run around, come back with options. Don't come back with a plan, come back with options. I would have presented them to the Premier and said, okay, for zoonotic transmission, here's your 4 options. Put your finger on the one you want, Premier. But we keep the other 3 just in case that one starts to slip. We've got other ways of handling it, right? And guess what? If we have to go from option C to option A, the people that helped build it know that was option A. Like the pork producers, everybody was in the room. So we say, okay, guys, C's not working. We're going to A. Done, right?
Okay. You've already told us a number of players who would have been central to this that weren't, like the schools and the municipalities, urban and rural, the beef and pork and other livestock producers. You talked about having the major utility companies involved to make sure critical infrastructure didn't go down. it doesn't appear to me that any of those are at the table. Are there any other players that should have been involved that you would have brought into the mix? Because you've broadened our mind into thinking about how this could have been approached by bringing some of those other players. And I should mention the long-term care facility operators too. They seem to have been missed in the mix also in terms of consultation. But is there anyone else that we need to understand, so that if you were to take a broader approach, so that we can see what was missed by putting a doctor in charge with the very narrow focus they had on one particular goal? What else have we missed out on? What do we don't know that we don't know?
Well, I will take you back to the tube chart. I really wish we could have had the tube chart up and opened it one step at a time. Look at every one of those tubes. Now, those are the tubes that would fit on a graphic so you could actually read, but there's a few more off on the left and right. But just look at those tubes. Every one of those tubes has an association, if it's largely private sector, or if it's public sector, they have a deputy minister. The regulators of all those tubes fit under the deputy ministers, right? But the actual private sector partners, I would pull them in. One of the critical ones is information communications technology, ICT. We want to have better communications. We don't want to go down. And remember that bullet 2, making sure that all critical infrastructure is available. You're not trying to say that we're going to send healthy people home. But in a pandemic, when people get sick, and we see that people of all ages do get sick, what you're looking for in every one of those tubes is what I call venturis. I'm going to use livestock as an example. No, let's use livestock, because otherwise you can get too touchy on other things. At the top end of the hopper is all the cow-calf operations, right? Let's talk about cattle. So you got all the cow-calf, and they're spread all over Alberta. None of them are critical infrastructure because there's redundancy, there's speed of repair, there's a whole bunch of reasons why they're not critical. You just got a whole muck of them. Then you come down to the abattoirs, and everything comes to a funnel through that abattoir. Mm-hmm. When you hit that abattoir, what you're worried about is, are so many people sick that work in a venturi that they actually cannot come to work? Not are they going to give it to their buddy, can they not come to work? All right? And there's ways to make sure that we can help make sure that it doesn't travel around, but you never send healthy people home. You bring in the surge capacity you made, and you worry about surge capacity for every one of those venturis. So in the power grid system, you got lots of generators, you got transmission, you got distribution. There's certain key points in transmission. For ICT, there's nodes that we're worried about. We make sure the staffing levels are guaranteed. You talk to each one of those tubes talking about critical infrastructure. We know what it is. Emergency Management Alberta holds the classified secret lists of every piece of critical infrastructure in Alberta. I will bet you none of them have been called.
You know what's so interesting, David, is that it always seems like the outbreaks at our processing facilities catches them by surprise. And then the first reaction is for the unions to say, we've got to close this place down. You're proposing the opposite. Be proactive and make sure that you develop strategies so that you can keep that critical infrastructure open. It's flipping the whole strategy on its head.
And it should have been done in March.
All right. Well, let's, I'm just trying to, I'll keep on looking at the screen in the event you've got some questions there. One of the ones that came up a little bit earlier was, how do we get out of this? I guess that we've been we now know what we should have done in the past if we could have done it all again. But I think you've got people who are now so entrenched in the approach that we have taken. I guess, what do we need to do? What's the call to action? I've mentioned, I think that there's some role to put pressure on the municipalities, but you've said that they don't really have the legal status to do anything differently. I mean, I suppose they could put enough pressure on the government that the government might start opening up regionally. Is that the solution? I mean, they've done that in Ontario. I can't imagine why we can't do it here. Why can't we go back to the kind of relaunch map that we had last summer, where if you've got below 50 cases, you're open. If you got 50 to 100, you got enhanced measures. It's only when you get over 100 that you end up with the stronger measures. I've been trying to find some way, now that we've gotten to this point, of easing us back into the kind of freedom that we should be having. I just don't know that you can end all restrictions all at once. I just don't know that the public is there. They've been so terrified. So tell me how we get out of this.
Okay, so two parts of an answer. The first answer is this has to come from the Premier's office in every province in Canada. The only way a Premier will change their opinion at this point is by the public telling them they have to. So my call to everyone who's watching is, first of all, every one of you call the Premier's office and demand the 8-step process. So I'm going to go to that next. But number one, actually call the Premier's office. Number two, call your MLA and tell them how unhappy you are and that their re-election depends on getting out of this mess. So this is a political process. You have to call the Premier and you have to call the MLA. And yes, you can send them an email and yes, you can send them a letter. But I'm told that if you actually phone the office and swarm the switchboards, that gets the most attention. So no matter what province you're in, because I know this is being transmitted, in fact, as far away as Australia, I know people are watching in Australia and they have the same attitude towards lockdowns as we do, non-pharmaceutical measures. You have to get the politicians' attention. This is a provincial jurisdiction. We have to change our premiers' minds. The premiers then have to take their leadership role and take back control, and in my opinion, put emergency management back in charge. And I don't mean in charge. They got to go back to being the coordinating agency, taking the subject matter agency's advice on the actual illness, which is health, but then talking to all the other sectors. You give them 1 week to build the exit plan. They come up with options, they present it to the Premier, but within 1 week, they have to have developed the options and put forward a coherent plan that will be published to the public. It will have sub-plans that may come out in steps, but you don't go to the municipal order and government say you can open up and you can't. In my opinion, here in Alberta, that would be the wrong thing to do because we got our municipality side by each, and so one's open, one's not. Everybody goes nuts. I say that within a week, we should reopen Alberta. And the reason I say within 1 week is we have massive mental health issues that we've got to deal with. We've got massive societal disruption that's been called. We have absolutely crushed our children's education, and we have to rebuild that. It's going to take us at least 1.5 years to put back the missing academics. The socialization is going to take a generation. So we've got to recognize that we've caused these problems and actually have a mental health plan with additional funding, a social development plan, an education plan. We need to have a complete economy recovery plan. And we need to put in place a plan for all those people who had severe illnesses that were too afraid to go to the hospital. Yeah. Because if they have felt a lump in their breast, odds are they didn't go for their mammogram, and it's now much bigger than it was a year ago. If they had feelings of a heart attack, they probably actually had one and now have heart damage that's going to need to be dealt with. We've seen this worldwide. CDC, the Centers for Disease Control in the US, has estimated that there is a 20% bump in severe illnesses causing death, and if not death, near-term death, because people have put off because they are so afraid. We need to have, the Premier needs to be given a complete plan based on the confidence in government slide that's in the bottom of that deck, and he needs to be in front of the cameras every night for 30 days minimum, speaking to every point on that slide. One night talking about these 3, one night talking about those 5, but the first night talking about all of them and saying that he's going to talk about all of it. And every day is confidence. The whole idea of basing reopening on case count is wrong. Case count is simply not important. Case count doesn't tie into what we're talking about. And that's by chasing case count, we've given credence to the fact that we thought that lock terms actually affected case count. They don't. So what's going to bring the case count down? It's called spring.
And well, I mean, I guess last year we had a little bit of a surge in spring, and maybe that's where the problem came. Is they thought
that's when the disease first arrived. The disease first arrived in February and March, and so it had its way. And by the middle of April, it started to go down. In fact, it started going down. If you say it takes 2 weeks for the lockdown to take effect, it started going down before that 2 weeks was up, because that's April and May. And if you look, by the time it gets to the end of May, it flattens out.
So David, then let me ask, because I think that's what they're fearful of, is that because we had spring break last year and everybody traveled and brought the disease back, that's why we have to have this extra period of lockdown. Go to your point about case counts. I could hardly believe it. We've seen an 80% reduction in COVID in the last 6 weeks. And there's a story today from a medical expert saying they calculate the real R value at 1.09. And this is the reason why we have to be terrified and continue to stay locked down. I don't even know where they pull this information up. However, I think there is something to this, that because it emerged last year and we did the initial lockdown in March, April, I think there's some sense that we'll get a third wave in March, April. And so this is, I guess, the problem, the political problem that they have. If they do, as you're advising, we open the entire province up. If we end up with a repeat of last year where you get a bit of a mini bump, then aren't we going to just have to, isn't the public primed to just lock back down again? I guess that's the problem. This is the argument that the Premier's making. I don't want to open and then close and then open and then close. How do you get over that now that that's been the expectation that's been created?
You tell the public the truth. You tell them that we should never have based anything on case count. And I put you that the way the seasonal curve goes, it's in the deck. I'm sorry we can't show it. But what it does is it goes up exponentially from the middle of October. It peaks in the first and second week of January. It drops down, but it drops down to a bumpy sort of halfway up, halfway down level. And so you're going to see ups and downs all the way until we get to the middle of April, and then it drops off almost exponentially. And by the end of May, we're coming out the other end, and then we have our nice 4 months of summer, and it goes back up again in October. And that's what the worldwide studies have found in totally non-lockdown countries compared to total lockdown countries. If you look at the graph for instance, for Belarus, and I would never use Belarus as an example for anything other than Belarus, the dictator in Belarus said, this is all a scam, it's all bullshit, I'm not doing anything. He held huge COVID parties, they had mass gatherings. If you look at the actual case count curves for the UK, which has done severe lockdowns, and Belarus, you can't see a difference between the line of the two graphs. So using this whole idea is the flaw. So if the Premier actually says, we've got the hospital capacity, we're not worried about it, catching COVID is really serious for some people, and you know what? We've taken care of them. We've taken care of our seniors. In some cases, we fully vaccinated some long-term care homes. We're going to use the rapid testing in the ones that are left. We're going to make sure that we take solid care of our seniors in long-term care homes, 73% of all the deaths in Canada. We're going to take care of our seniors that are living at large. We're going to offer them, if they wish, to come into a government-provided, very, very nice quarantine center till we get them vaccinated. And now it's only until we get them vaccinated, right? It's not for the second wave, all the rest of that. You build this whole confidence. You don't talk about case counts ever again, because we know that what we're doing doesn't affect case counts. So if there's bumps and hollows, fine. Ultimately, they go away. Do I think there's a third wave coming? Absolutely correct. But I think there's bumps and hollows in the spring. The third wave is going to start in the middle of October, just like it always does. And the third wave is going to have some variance in it, and it's going to go up exponentially till December, unless we've got everybody vaccinated appropriately for those variants.
So we've got to get up.
Are we going to do this all over again?
And that's what I fear. I think you're right. I see that Drew Barnesy is on the line. Now, Drew Barnes, of course, is an outspoken MLA, along with Angela Pitt, who's been calling for a reduction in restrictions. I'm glad that he's tuning in on this. He's been quite a voice for freedom, even though it's in this environment perilous to do so. But he's wondering, because I know that there's a step in the actual pandemic plan about the economy. He's wondering what steps you'd advise Albertans to take to help free enterprise, restart the economy, and to focus on the needs of their families. Is this something that will happen organically on its own and you just get out of the way? Or are there things that emergency planning should do to help things along, to kickstart the economy?
What emergency management does is brings together the smartest people in Alberta and asks them to help build a plan. They run a planning process with those smartest people in Alberta across every one of those economies. And so in that 1 week period that I'm talking about, there should be a group that is focused 100% on the economy, breaking it out into the appropriate tubes. And I would suggest to you that places like tourism and small business deserve a special nod in the planning process. They should be at the front of the line because those are ones that have been really hit. And restaurants and bars and all the rest of them that have been actually physically shut. And so you bring them in the room and you say, what's it going to take, folks? And you bring them all the best minds across all the different sectors. You build options across each of the sectors and you present them to the Premier. And the Premier says, I like option A, B, C, D, E, and in this one I'll go for option A and that one for B. And you get the whole idea from the people most involved. The one thing that there's regulators in these sectors that tend to be from government, right? They should be in the room too. But you ask the actual people and you run a planning process, because it's important that you don't just hear what they have to say, because you're allowed to disagree with them, and go back and forth until you come to a plan that you agree on with each other. Does it need money from government? In a lot of cases, probably not. What it needs from government is for them to get out of the way. In some cases, it will need money from government because they've been so crushed they can't recover on their own, and they might need a little help for a short period of time. I'm not a favor of long-term supports, but I'm certainly in favor of short-term supports, but that's Dave Redman's opinion. Dave Redman is the coordinator. He runs the process. He hears what people says, and we present the options to the Premier, and the Premier has a huge problem because we're going to need more money in mental health. We're going to need more money in the education system. We're going to need more money to recover the health care of the people that have the long-term health. There's going to be money going in every direction, and I'm talking large pieces for things to fix the problems we caused by lockdown, but there's going to have to be some support to help industry reopen. And so I'm not saying just to open up and go wild and crazy. I'm saying bring them together and develop a plan with them and do it sector by sector, and let's get their input, and then we can see whether or not there's enough money to do what they ask for, or if they're just saying get out of the way, then we say, okay, option A is get out of the way.
Let me get your response to the Premier, because whenever I've posed this to him, he always bats down my argument as some sort of libertarian talking point and not practical. And I put to him, the point I was trying to make is exactly the one you made with Belarus, is that what didn't matter, if you look at Florida, South Dakota, Sweden, Belarus, the virus had its way with us, whether you locked down or whether you didn't. That was the point I was trying to make to him. And his response back was, if we'd done what South Dakota did and had their death rate, we would have had X many more Albertans die. If we'd done what Sweden did, we would have had X many more Albertans die. And I understand why he's making that comment. It's because, in fact, Alberta did a pretty darn good job of protecting our seniors in long-term care. Certainly far better than in Quebec, where they were putting COVID-positive patients from hospitals into nursing homes and infecting everyone. We did far better here. And so we have a low rate, but he's connected that somehow with the lockdown. And I don't know how we make the argument to him that we can still maintain protection from our seniors without having the entire society locked down. Because the notion I seem to get from them every time I've talked with somebody is that it's because we've got a lot of community spread that is causing us as we're, I guess, going about our business at the shopping mall or whatever, to inadvertently infect somebody who is a worker at a long-term care facility, and they're taking it in. Therefore, the way to stop it from getting into long-term care is to lock us all down. That's the only thing I can understand about the argument. And I'm just wondering how you would dismantle all of that, because it feels to me like there's something not logical about what they're putting forward, but I can't quite put my finger on how to challenge it to try to change some minds on it.
It's very simple. Deaths, if you look at deaths and use deaths as the entire point, 96.1% of all deaths in Canada have been in seniors over the age of 60 with multiple comorbidities. In most cases, 3 or more. We're talking about really sick people. So the logic that started on the 15th of March, which is totally not logic, because prior to COVID, every plan that was ever written and all of the documentation on non-pharmaceutical intervention said you cannot control the spread of a virus by using lockdown, by using any of those So you first of all have to disconnect the deaths from this idea that lockdowns caused less deaths. They didn't. What caused the deaths was not quarantining our long-term care homes. 73% of all deaths in Canada happened because COVID went into our long-term care homes. Locking down clearly didn't stop that, right? We killed over 20,000 Canadians, over 15,500 of them in long-term care homes because the staff went home at night. And so thinking that a lockdown would stop the staff from catching COVID is a complete misnomer. We know that it spreads through the community in lockdown communities and non-lockdown communities exactly the same. We knew that before. We've now got scientific studies saying that it happened again. We learned the hard way. So the deaths aren't related to lockdowns. So 96.1% of the deaths are in seniors with multiple severe average age of death 84. So the seniors with multiple comorbidities that are living out in society should have been offered a safe quarantined area to go to in a very humane and loving manner. And then you've dealt with the deaths. The rest of us have more chance of dying of heart attack than we do of COVID in every age group, including seniors over the age of 60 without multiple comorbidities.
I need you to put another underscore under that, because I was on Ryan Jesperson's show today and he repeated another talking point that I've heard many times from doctors is, yeah, but if you look at the comorbidities, if it's cardiovascular disease and it's diabetes and it's heart disease, and 75% of our society, maybe it was over 75%, even in the 40 plus age group, have a predisposition to some of those conditions. Like the notion there is that you're just as at risk as a 40-year-old with diabetes of dying as a 90-year-old with 3 conditions. And I don't know if that's what the statistics show. So how do you dismantle that argument? Because I think what they're now trying to do is trying to make it as if everybody who has a pre-existing condition is equally at risk.
And it's simply not true. If you look at, let's use the Alberta statistics. The government of Canada hasn't produced statistics on comorbidities, but several of the provinces have.
Well, they have. I think I've seen it. You didn't you print them?
That was the Alberta stats.
Yeah. Okay. Yeah. Okay.
Okay. 70% had 3 or more comorbidities. Now, what do you do for the people that weren't in, and most of them were concentrated in long-term care homes. So let's talk about the ones that weren't. We have family practice doctors. They know their patients really, really well. They know the ones that are severely ill who have 2 or 3 comorbidities. They also know the ones that have a well-managed single comorbidity. So to say everybody's got a comorbidity, as some of the doctors that are on TV are saying, it's a red herring. You got to watch for the red herrings because they are trying to sell the campaign of fear to justify lockdowns. Yes, if that one comorbidity is really severe, their family practitioners would know. So instead of going for this blanket, we got to keep everyone from catching COVID, which doesn't work. Even if they wanted to say that, it doesn't work. We should have been working with the family practitioners across our province saying, we need to know from you who are most at risk. How many have 3? How many have 2? Right?
Yes,
Start with 3. And how many have 4? Right? And work your way down that aren't living in long-term care, and gone immediately to offer their families an opportunity to do some kind of an isolation quarantine system, or even do it at home. If one family member wanted to stay at home with them and there was a family situation where they could do that safely, there's so many options, but we didn't even talk about them. You bring the family practitioners in. I don't know how many family practitioners I've talked to across Canada who are madder than hell that they weren't part of this discussion to handle that comorbidity question.
Great point.
So yes, there's lots of comorbidities out there, but they're not severe. They're managed well. Someone who's on diabetes, who's completely managed, their risk of dying of COVID is pretty small compared to someone who's got diabetes, heart disease, and a pre-existing lung condition, right?
Now,
the family practitioners know.
Yes, exactly. One more reason to bring everybody in. Now, I know we said that we'd go for 2 hours, and I think we're closing in on the final, and Derek may want to have a final question, but I wonder if I can ask you kind of a philosophical question, because it strikes me as strange that you, as a military man, who we think of as the law and order guy, the ultimate law and order guy, you talk more about rights and balance and restraint and having a really darn good reason to violate rights than any medical practitioner, than any of our premiers, than any of the people who are in charge of the public health response. And what is it about your training and your discipline and your approach to this that has you caring about rights and no one else does?
Okay, I'm going to answer it in a couple of parts. First of all, when I was officer in the Army, I trained my soldier on the Charter of Rights and Freedoms. It was my personal opinion, okay, and I have to say my personal opinion. Every officer in the Army gets their commission from the Governor General, the Queen. So it's called a Queen's Commission. But ultimately, in my mind, while I followed the orders of the Government of Canada on all my deployments and they decided which operations I went on, I believe that as a soldier, my number one responsibility was to defend Canadians, because governments come and go. Canadians, in my opinion, are different than anyone else in the world. And what makes us different? People say, oh, there's no Canadian culture. What makes a Canadian different is our Charter of Rights and Freedoms. You show me one other country in the world that has a charter like ours, that is written as well, and that defines individual rights versus those of the community, and does it in such a manner. And so I always taught my soldiers, read the charter. I have a copy right here in my top desk drawer. I've had it in my top desk drawer since the charter was issued. I believe in the Charter of Rights and Freedoms. So let me go to the second part of my answer. When I was placed in charge on September the 12th, to first of all lead a team to design, and I led a team. Dave didn't write the Alberta Crisis Management Counterterrorism Plan. I led a team of 26 of the brightest people in Alberta through a process, and we wrote the plan together. And then Dave was ordered by the Premier of the day to implement it. It took 2 years to implement it with all of our private sector, because 85% of critical infrastructure is owned by the private sector. But at every step of the process, I never wanted to get a Patriot Act. I wanted to ensure that the Charter of Rights and Freedoms in Alberta was never compromised. And there would be times when we would have to declare in a terrorist attack a state of public emergency, and I would limit the pieces of the charter that would be affected for the shortest period of time, with a full explanation of why and what the duration would be and how we would get out of it. Right? What was the get out of jail plan at the end of it? To me, Canada is a wonderful, wonderful place. I don't support inappropriate civil disobedience. I simply don't. Because as a soldier, I was going to be the one that was going to ultimately be called to stop unlawful civil disobedience. Lawful disobedience, go for it. Don't expect me to be standing on the ledge steps with you. I'm the one working behind the scenes, trying to get the premiers to do the right thing. Dave's not the guy that's going to carry placards and run at the thing. I saw what happened when confidence in government got destroyed in many countries of the world, where I unfortunately had to take young Canadians into, and you never want to go there. Yeah. So my idea of the charter has always been to support the minimum imposition of any violation of charter rights, right? For anything, for a pandemic, for counterterrorism, and boy, people were ready to throw their rights in September of 2001, and I was the guy who said no. I briefed the privacy commissioner personally and explained to him how I was going to minimize it, but that there were times when I might have to step into some privacy issues, and we went through every step of that process, minimizing. So in the case of this pandemic, I don't believe in the use of non-pharmaceutical measures. for obvious reasons, because I believe they were proved to be ineffective before, and they've been proved ineffective again. That means to me that I don't believe we should have had to impose charter restrictions, except in perhaps some extreme cases for a very short period of time. And so the charter rights that I'm clearly suggesting that I would violate was in long-term care seniors' homes. Right.
And so if we had taken a minimal approach, then you'd have less civil disobedience, and Pastor James Coates wouldn't be in prison languishing because he wouldn't have been violating any laws, because they wouldn't have gone to the extreme of forcing him to abide by rules that he didn't think he could. So if I'm to hear you correctly, you probably don't support the pastor breaking the law, but you also don't support the government having put such extreme measures in the first place where he felt it was his only choice.
So let me be very clear. I never support breaking a law, right? A law is a law, and as a soldier and as a citizen, that's not what I do. But that's me. I have my reasons, and I understand civil disobedience. I understand it. It's just not me. And everybody makes that decision themselves. I don't think he should have been put in that situation, but when that rule is made, you follow it. I also believe in leadership by example. So to me, what happened with some of the MLAs when the government made rules, as a lieutenant, I was told by a full colonel that I tried to emulate my whole life. One of the rules he told me as a young lieutenant is never make a rule that you either don't plan to follow or you don't plan to enforce. I was taught that as a lieutenant because the minute you do that, soldiers realize you're not genuine.
And that goes back to, if you put a bunch of rules on Albertans, then don't hightail it out of the country so that you can enjoy restaurants and beach holidays when you're not allowing us to see our parents for Christmas. I think that's a good note for us to end our conversation on. Let me hand it over to Derek Fildebrand. Derek, thank you so much for hosting this evening and allowing me to be a part of it.
Oh, you were the host. I was the technocrat. I'm greatly appreciative to you both. This is a fantastic interview. This only kind of came together Friday. Some mutual friends of all three of us kind of plugged everybody together. And I said, "Hey, what the hell?" And here we are. This is not much of a record viewership broadcast, at least on the live numbers so far for the Western Standard. I have no doubt that it's going to be a record overall for people who listen after the fact on Facebook, on YouTube, on podcast. I'm very grateful to you, Colonel, for your participation and what you've done here. What's funny, I was actually kind of looking at your image, and I was like, "Oh, you're really giving me a real army glare, but you're actually just frozen." I remember getting the glare from officers when I was a cadet, and you were giving me that look. It's kind of frozen in time. And Danielle, hell of an interview. I don't think anyone could have done it like you here. It's you know this stuff inside and out. Thank you so much for giving a very educational, very informative interview here. We've had 2 hours. If we were smoking weed, this would be the Joe Rogan show. So
and swearing.
Yeah, we have to drop a few more F-bombs to make it fully Joe Rogan. But we're at Joe Rogan length right now. I could go on, but I've got to go to the bathroom. And actually, outside right now, there's a blizzard developing. I don't ever really watch the forecast. And for the first time ever, I've seen a flash of lightning in a blizzard. I've never seen that. It's very scary. If COVID doesn't scare me, then a lightning blizzard will certainly scare me. So I think that's a good omen for us to wrap it up with. There's still a ton more comments we didn't get through. I think we've had 1,600 comments on this so far. It's been absolutely huge. But so thank you both for an absolutely excellent program. I'm very, very honored to have you both on with the Western Standard here. We're planning on aggressively growing our broadcast, and this is certainly a great example of what we could be doing. Now
Can I just butt in for just a sec? I just want to say thank you. And people say that I glare all the time. Really, I'm smiling on the inside.
Yeah. But my dream actually was always to be in the forces, and once I started growing a beard, I realized I could only be in the Navy. So,
not true. They've got a new facial hair policy. You can grow anything you want.
I did see that, and I actually started exploring joining the reserves, but then the Western Standard just kept me too busy. I always have an excuse not to join the reserves. My dream job was always to be a submarine captain, but I think I'm a bit old to start down that career path. Now, there's been the two most frequently asked questions here. The first was, how can I share this with people? Like we're not getting this in the mainstream media. You know, the Western Standard strives to be halfway between the mainstream media and the alternative media. We're trying to give you kind of the credibility, professionalism, for very much lack of a better term, of the mainstream media, but also the feistiness and the willingness to ask questions that the alternative media has. We try to be between the two. This video is going to be saved permanently on Facebook, assuming Facebook doesn't deplatform us at any time soon. And the same goes for YouTube. This is going to be saved on YouTube, and you can share it with people, even if they don't have a Facebook account. Again, assuming YouTube doesn't deplatform us. We also will have this on podcast. Our podcast editor, Corey Morgan, who's been watching the whole time, loving this interview. He's going to be posting this very, very soon on our podcast stream. You can subscribe through your favorite podcast provider. So you're going to be able to get it there. I also, though, the Western Standard, we're kind of new to the broadcast side. This is kind of a new frontier for us. We're primarily the written word. We do news and we do opinion columns. To put you on the spot, Colonel, I'm going to invite you right now on the air, so you better not embarrass me and say no. We want you to do a guest column on this. We've had controversial, very credible experts like Dr. Dennis Modry before, who just the mainstream media would not listen to once they identified him as a dissident, essentially. And we gave him space on the Western Standard to write an extensive letter to the editor. An open letter to Premier Kenney. I think what you've got to say is too important not to be heard. So I want to invite you to take that great PowerPoint presentation you've got. You can work with us, and I want to invite you to work with us to boil it down into kind of a readable, open letter, so that people can read what you've had to say here today.
Well, the PowerPoint came from a letter I sent to all 13 premiers, so it should be an easy job.
Oh, that's beautiful. I really hate editing other people's work because they don't like me editing their work. So that works well for me. Thank you so much. We're going to reach out to you, Colonel Redman, to make sure we get that happening as soon as possible. Now, the second most, and I'm expecting a terse and dismissive answer from you on this, but the second most asked question we had as I was monitoring it actually froze my computer sometimes. We had so many comments coming in. The second most common question and comment we had was, are you going to run for premier or prime minister? This man needs to be assured. I know you're a military man. You're used to earning your job, not begging people in a popularity contest. And I'm sure this has probably not really crossed your mind, but I got to put it out there because it was the other most asked question after how can we share this.
I have to be very honest. My past life has left me with challenges. And so while I'm totally willing to work with people and to offer advice, I simply don't have any time, I don't have the ability to take a full-time job. I have to deal with the issues that came from my career in the military and my time with the government of Alberta, and I have to take care of my wife and my children and my grandchildren.
Hell of an answer. That's, Danielle and I get asked this kind of question frequently enough, and no one ever believes us.
That was a very believable answer. I believe David.
I mean it, and I think, and I actually believe Danielle when she says no way, but I really believed you. So, okay, there we go. Well, okay, before we wrap up, I want to thank everyone who's currently a Western Standard member. You are contributing to bailout-free, independent Western media. You are the beating heart of the Western Standard. We're very grateful for it. If you're not yet a member of the Western Standard, what the hell are you waiting for? You're paying your taxes to the CBC. You're paying your taxes to the mainstream media to support them. If you don't want to support us voluntarily with your money, support other independent media. Give your money to anybody but the CBC and the big corporate media who are sucking on the government teat. But we prefer if it's to us. So thank you very much if it is. We also have to thank just a couple of groups who put this all together. I talked about these, this kind of network of mutual friends. I actually don't know everybody involved. There's a lot of people who are involved who I don't know. So I hope none of them are too nuts. But I love the people I know who were involved in putting this all together. So we want to thank Rally for Resources, Alberta Blue Skies, and Rally Canada. Just a great network of people came together to make this happen. Very grateful to you all. Tip of the hat to you. And of course, I should say the third most frequently asked question was, what was the Premier's office's phone number? So just because we've had to work late tonight, we're going to give it to you. It's 780-427-2251. If you've got something to say that you saw tonight, call that number. Tell them the Western Standard sent you. Okay, well, thank you very much. Again, to Danielle, excellent guest hosting, and to retired Colonel David Redman, absolute pleasure. Thank you very much. God bless.
Yeah,
thanks
again. We'll see you again. Bye, everyone.